is Obo Felicity Itoan. I'm a fellow of Caregiver Nigeria Society. I'm here to talk about diabetes in pregnancy. Pregnancy is a beautiful journey to embark on. Pregnancy comes with lots of changes, and most of these changes are not quite obvious. Do you know that a woman can have diabetes in pregnancy even though she have no previous history of diabetes before? This condition is known as gestational diabetes, which occurs with little or no symptoms, but can badly affect both the mother and baby if not properly managed. It is very common, but many people are yet to realize this. In this video, we will break it down in a simple and practical form for you to understand what diabetes in pregnancy is, how it happens, the early signs, and how it can be detected on time. We will also go through how it can be managed in order for you to have a safe, healthy, and confident pregnancy journey. Let's walk through this together. So we will start with diabetes. What diabetes is all about. Diabetes is a condition that happens when your sugar in blood is too high. It develops when the pancreas do not have enough insulin or any at all, or when your body is not responding to the effects of insulin properly. Diabetes occurs in all ages. We have what we know as diabetes in pregnancy, which is our major topic of today. Diabetes in pregnancy is also known as gestational diabetes, which develops during pregnancy, usually during the second or third trimester. We have the types of diabetes in pregnancy. We have 1. Gestational diabetes. Gestational diabetes occurs during pregnancy, during the second and third trimester. We have pre-existing diabetes. Pre-existing diabetes is when the woman already have type 1 or type 2 diabetes before being pregnant. Then 3, we have LADA, latent autoimmune diabetes in adults. An autoimmune form of diabetes can develop during pregnancy. Then we have the causes. Hormonal changes. During pregnancy, lots of changes occurs in the human body, and those changes can also affect our hormones, which can result in diabetes for a pregnant woman. We have insulin resistance. Insulin resistance is when the body is not responding to the insulin being produced by the pancreas. We have signs and symptoms of diabetes in pregnancy. 1. Increased thirst and dry mouth. There is this urge to always drink water. Then 2, we have frequent urination. This usually occurs especially at night. We have fatigue, blurred vision, recurrent infection, slow healing of wounds or cuts. Then we have risk factors for diabetes in pregnancy. Being overweight before getting pregnant. Having a family who is diabetic. If a person have had gestational diabetes before in the past, a person has given birth to a big baby, which is microsomic baby, before in the past. And lastly, a person above 25 years of age. We have risk and complication of diabetes in pregnancy. We have maternal complication and fetal complication. For the maternal complication, we have preeclampsia. We have high blood pressure, cesarean delivery when necessary, and lastly, future development of type 2 diabetes. For the fetal complication, we have microsomia, that is large baby. This is one of the signs of a diabetic baby. 2, we have hypoglycemia, stillbirth, preterm baby, respiratory distress syndrome, jaundice, which is the yellowish discoloration of the eyes or skin of the baby. We have obesity and type 2 diabetes later in life. We have screening and diagnosis for diabetes in pregnancy. 1, we have fasting blood sugar test. 2, we have random blood sugar test. 3, we have universal screening between 24 and 28 weeks gestation. 4, we have oral glucose tolerance test. And lastly, we have fasting plasma glucose test. We have management and treatment of diabetes in pregnancy. One, we have lifestyle modification, healthy diet, eating balanced diet, food rich in carbohydrates, protein and healthy fats. Then we have regular physical activities. Before you carry out any regular physical activities, which may be an exercise, you have to inform your healthcare provider, and we have monitoring of blood glucose level. Also under the management, we have medications. Insulin or oral hypoglycemic drugs can be given if necessary, but it must be prescribed by your healthcare provider if you need it. Then lastly, we have monitoring. Regular prenatal appointments. Keep to your antenatal appointments is very important. And lastly, we have fetal surveillance, which is ultrasound and non-stress tests. We also have management and treatment of diabetes in pregnancy, during delivery and postpartum care. Timely and mode of delivery, vaginal or cesarean section, as the case may be. We have postpartum glucose monitoring and follow-up appointments even after delivery is very vital and important for a person that have diabetes during pregnancy. Then we have management and treatment of diabetes in pregnancy post-delivery. We have breastfeeding. Breastfeeding is very important and vital for both the mother and the baby. We also have strategy for preventing future development of type 2 diabetes, such as losing small amounts of weight. It's going to help the mother in a very long way. Eating healthy diets and exercise. Diabetes in pregnancy is more common than what people think, but the good news is it can be managed effectively with the right care. The most important things are early detection, regular antenatal checkup, and following the guidance of your healthcare provider. Don't ignore screening tests, and do not assume you are clear just because you are fine. Stay informed, take proactive steps, and prioritize your health for both you and your baby. If this was helpful, share it with someone who might need it, and follow us for more simple and reliable health information. See you in the next video. Thank you.